Well, it totally summarizes in a very powerful sentence the fact that major social injustices in the U.S. are driving, once again, the major inequities in the way a disease like COVID-19 is hitting at a much higher rate minority groups, including Latinos, African Americans, and Native Americans. So there is no doubt that this social injustice and, quite frankly, racism is leading to a very, very large number, millions of families in the country do not have access to healthy food, do not have access to health care, to be under duress or stress chronically, and as a result, to be much more likely to develop obesity, hypertension, diabetes, and other conditions, which at the end of the day are massive risk factors, not only for getting COVID-19, but for dying from it.
What about the economic contribution that the Latino community is making here in the U.S., specifically during the closures because of COVID-19? How have they been driving the economy?
I think that most people in the country that are non-minorities truly don't understand and don't appreciate that the only reason that food is still being picked in the country, that it is being moved around, that many services, essential services, have been able to continue is because of the hard labor and sweat of Latinos and other low-income groups in the country.
What about the experiences that the Latino community has had with the healthcare system in the U.S.? How has that factored into this COVID-19 pandemic?
Well, during the Trump administration, the Latino community has been living in constant fear. If they don't have health insurance, they are very, very unlikely to even try to approach a health center because of fear of deportation. Some of those who had health insurance have lost it as a result of the constant attacks from this administration against Obamacare, which actually increased dramatically the proportion of low-income families, including Latinos, who for the first time had access to health insurance.
What sort of challenges have there been in getting the message and actual testing to this community?
There has been zero leadership at the national level in general for the whole population. And the poorer people are, the more language barriers they have, the worse the situation becomes. So they are at the bottom among the very bottom in terms of the ranking of priorities. So they just don't have access to the levels of testing, of contact tracing, of ability to quarantine, which would require sound social protection, unemployment benefits, and access to healthcare. So they don't have access to PPE, to personal protection equipment. So I would say that in many ways, the federal government has abandoned them totally during this pandemic. And some states have been able to manage better than others, but overall, there is very, very little attention that is being paid to the needs of Latino communities, including the thousands of children that are still being kept in cages in the border between Mexico and the U.S., many of whom come from Latin America, living at constant risk of COVID infection.
So these are some of the challenges and indeed significant hurdles. We've been watching for weeks, for months, the U.S. president, these coronavirus task force briefings. I haven't seen a single Latino voice there on stage. Is anybody listening to your voices?
So we're doing the best we can. In the state of Connecticut, we've had a governor that has managed it very well. The pandemic, we're one of the states that are in best shape, and he has listened to science, and he has listened to community representatives. So Yale University is in a very poor city, which is the city of New Haven, and I am very proud that the city has actually opened its arms and its reach to the Latino communities and many other immigrant communities that we have the privilege of having a chance to talk to and exchange on a daily basis.